you're online, I think. Yes.
Yes, I am.
Please go ahead.
Thank you. Thank you very much for the question. I think first I want to start repeating a little bit what the DG raised, like this imminent ceasefire is the best news since long times. And of course, we welcome the announcement of a deal, secure ceasefire and hostage release in Gaza. We, of course, hope that all parties will respect this commitment to fully implement the deal and work towards this so much needed lasting peace. Now, you asked a bit about WHO and its partners. Yes, they are ready to support the health system and the people of Gaza, expand this support rapidly. So scaling up operation, mobilizing critical supplies and resources to first address the immediate needs and support also, and we are already working on that, early recovery rehabilitation. What is critical though is the significant security and the political obstacles to delivering aid across Gaza are removed. So we need a rapid, unhindered and safe access and expedited flow away into and across Gaza. And restoring health system, I want to make this very clear, it's a collective effort. It will be guided and must be guided and executed in close collaboration with the Ministry of Health, the health workforce, the Gaza health workforce, the partners, and international community. So we also urge now, this is the time for member states, donors, and the global community to step up, to provide this flexible funding and to enable these swift and effective responses and for the urgent and longer term needs. And the UN cannot deliver the response alone on all fronts. The private sector is critical and private supply chains should be restored and basic commodities allowed to flood Gaza. Now focusing on WHO, so we already planning for first to continue, and the first year it will still be very much humanitarian support what we are doing, and then stepping up our support in early recovery, rehabilitation and reconstruction. For example, we have a contract to deploy, small example, temporary prefab clinics and hospitals. And they will be linked, it's already planned for, they're linked to the existing hospitals and facilities to expand the bed capacity to address urgent health needs and expand the service delivery in these underserved areas. And the focus of everything we already do, but we will expand with partners, will be, of course, trauma and emergency care, comprehensive primary health care, and it includes everything from child health and sexual reproductive health, non-communicable diseases, mental health and psychosocial support, but also scale up the international health workers in the emergency medical teams, which we coordinate and bring in, and so-called specialized care teams. Scale up the supply chains via all routes now into Gaza, not just Kerem Shalom, etc. And there's agreement working out. So expanding services, which we already do, not just in the south of Gaza, but also in Gaza City, and I can provide you with the examples. We want to expand in all areas, and not only the capacities of hospitals, also the primary health care. The role of the restored health infrastructure, and we have to really focus on very basic things, the partly damaged, utilities like water, electricity, waste management systems, malnutrition is in focus, and of course, restore and better be prepared for epidemics, disease surveillance and e-wars. Human resources is probably the most important. First and foremost, that we help to ensure that all Gaza health workers can do their job. There's many who've been incredibly resilient to do their job, but there's also many in these makeshift camps, etc., which need to be deployed into the health workforce. Then additional healthcare professional, including external medical teams, to fill some of those gaps. To massively, that's also a short-term objective, massively expand the medevac program WHO prepares. Because at this pace, we estimate, based on our estimation, 12,000 patients, critical patients, they will not be able to get their specialized medical care in Gaza, and they need to be medevaced. And since May, it's only WHO has done that. We only managed to get 450, 460 patients out of Gaza. With this pace, it will take 5 to 10 years. So we rapidly have to restore the medical corridor, the traditional corridor to East Jerusalem and the West Bank, but also into Egypt, Jordan, and then elsewhere. Public health and preparedness and the protection will be focused. And last but not least, of course, expand the coordination. Over to you.
Thank you very much, Dr. Rick Peppercorn. I don't see any ads in the room, so I'll go now to Gunilla from Svenska Dagbladet. Gunilla, please unmute yourself and ask your question.
On Trump and the new administration, I understand it's a transition right now, but if the biggest donor standing for 18% of the budget actually leaves, what is your thinking about how this can affect global health work and pandemic response in general? Do you see any willingness for other or new countries to step up in case? This is a question for Dr. Tedros. Thank you.
Thanks. But as I said, we really are giving, this is a government in transition. As for any country with a government in transition, you need to leave them in peace to make their own decisions. I think on funding, it's very important to look at the requirements for funding for the world. We've just had a very big appeal for emergencies, so we do appreciate your reporting on the very, very big needs for funding for global health. But essentially, there's really no further comment to make on the issue. So now I will go, the next question will go to Gabriela Sotomayor from Proceso. Gabriela, please unmute yourself and ask your question.
Thank you. Thank you very much, Margaret. Hola, Happy New Year to all. My question is a little bit unusual. It is about rare diseases. For example, an hereditary disease called EPP. These are people who cannot get the sunlight. They live confined in the dark. The treatment is very, very expensive, and governments do not offer them help. I mean, basically, for example, in Mexico, there's no help for these persons who are with this kind of disease. So migrants, displaced people, ordinary citizens, this could affect anyone. So could you talk about these rare diseases? Thank you.
Thank you. Really, really good question. And we do indeed work on the rarest and look to serve the most vulnerable. I will need you to send the question by email, though, so that I can ensure that we get all the information and the right person to speak to you. But thanks for such an excellent question and for your interest in the neglected and the vulnerable. So the next question, I have Rory. Rory from, sorry, Rory, I've forgotten your surname. I know it so well. Rory O'Neill. Please unmute yourself and ask your question.
Thanks, Margaret. That's okay. Dr. Peppercorn answered a lot of what I was going to ask, but I did just want to ask if he could expand on the rebuild in Gaza. Do you have an idea? You were talking about the need for support from international partners, private sector. Do you have an idea of how much money is required to restore the health service in Gaza to a level that can actually meet the needs of the population there? And perhaps can you comment on Israel's responsibilities once the ceasefire is in effect? What steps can they take to facilitate the rebuild, for example, like opening border crossings and so on? Any further information on what's required? Thank you very much.
Thank you. And we'll go over to Dr. Peppercorn. Yes, I can see and hear you.
Yeah. Thank you very much. I think it's, of course, a complex question. There are processes currently ongoing by the World Bank, the EU, the UN, and government to do the so-called RDNA, to do these assessments on on each and every sector, and then actually overall. So that's still ongoing. So WHO and my team is very much involved in the work on the health sector, and what we get for initial figures, and I think this is for that is massive. You talk about 3 billion over the next 1.5 year, and over the next 6 to 7 years, you talk about only for health something like 10 billion. But I don't want to speculate too much on that because that is still ongoing. All the work and the assessments are ongoing, and it has been, of course, incredibly difficult to do any proper assessments. We all have been focusing on the most basic humanitarian needs, and we then on health as WHO, leading and coordinating the health partners, but all the other other UN organization, agency funded programs, international NGOs, national NGOs, etc. All focus on the basic humanitarian support. We all know how difficult it has been to do any analysis and assessment, but if you look at the health itself, and myself getting into missions into Gaza every second month for a number of weeks, etc. Well, first, Gaza, we all know the destruction is so massive. I've never witnessed and never seen that anywhere else in my life. So that's overall. So if you think about infrastructure, if you think about generally, and if you look at health, all hospitals are either damaged or partly destroyed. A lot that same applies for the primary healthcare clinics as well. So yeah, when my team came back, I mean, like with this initial assessments for it was even more than 3 billion for the first 1.5 year, and then actually 10 billion for the 5 to 7 years. I was not surprised. And then we are just talking about health. So the needs are massive, but I think for the coming period, we should remain very pragmatic in what we do. So the focus over the coming period should remain very much on humanitarian support, also on health. And it's everything I mentioned, I think, in my first response. And then, of course, rapidly expand. And then, of course, assuming that the ceasefire processes, which is 3 phases, that it progresses to a lasting peace, and that's absolutely necessary, a lasting peace, that we rapidly expand in this early recovery, rehabilitation, and reconstruction. It is also, and already having discussions with the Ministry of Health on this as well, which might sound odd, it's also, of course, an opportunity to relook at sectors, including the health sector. So how can we now really base it properly on comprehensive primary healthcare, which was not always the case. It was more a hospital-centered system. So how can we do that? How can we work with an updated essential health package for Palestine, an updated essential health package, which should be the basis of all investments? A lot of work was done already before the crisis on this, and we're working with government and partners to further update that. And those processes should guide any investments. So work is ongoing on that. The cost will be enormous, but what is now needed is a continuation of humanitarian supports, pragmatic humanitarian supports, and I really would say flexible funding. The WHO, we're finalizing our report over 2024, and we are finalizing our operational response plan for 2025, and it will focus on this humanitarian support, but of course an expanded component on early recovery, rehabilitation, and reconstruction, and focusing, and I think Mike Ryan mentioned that as well, on the so-called humanitarian development nexus and everything related to that. Over to you.
Thank you very much, Dr. Peverkorn. Now we have Christian Ulrich from Deutsche Press Association. Christian, please unmute yourself and ask your question.
Thank you, Margaret. I'm just continuing on from this conversation. So my question to Rick Peppercorn, or maybe someone else, who is going to foot the bill on the reconstruction of the Gaza health sector? Are you looking to Israel to fund this, or is there an obligation maybe on Israel to foot a big part of this bill? I wonder whether you have any thoughts on that.
I'm not sure that that's really in our territory, but I will hand it over to Dr. Peppercorn because he's the expert.
Margaret, if you say it's not really in our territory, I'm not sure you should give it to me, but let me try to address that. I think this is really a collective responsibility and from member states and partners, including Israel. And if you look at it, this is also a chance and opportunity if we really get a lasting peace, that we get a long-term solution. And a long-term solution will require investments and support. Finally, for Palestine, it needs to be a Palestinian solution. So it needs to be a Palestinian solution, a Palestinian government, Palestinian civil society, a Palestinian private sector, with support of the UN, including we very much in WHO in health, and indeed supported and funded by member states collectively across the world, and that includes also Israel. Over to you.
Thank you very much. And we have last follow-up from Rachel Carlson, NPR. So Rachel, please unmute yourself and ask your follow-up question.
Thank you. I wanted to ask why there have been more Marburg outbreaks in recent years.
Very good question. I'll ask Dr. Abdi if he's got some theories.
Thanks. I think that's the million-dollar question that we need to all work together, and it relates to what DG said, how we need investment in preparedness and the pandemic accord. Definitely emergency will happen, and we need to be prepared. In terms of specifically where we are seeing more and more outbreak, particularly three things relating coming together: the ecology of the viruses, the human behavior, and the economic situation that are happening here. So viruses have been there, and they will be continue. But recently in East Africa and Central Africa, particularly the outbreak we had in Rwanda, the 2023 outbreak in Tanzania, and the suspected Marburg outbreak that's going on currently here. So we are seeing as more people go out into bats area, as more virus laboratory surveillance improve, we will be detecting more outbreaks that's going to happen. That's part of the nature. What we need from us is that preparedness and the readiness required, and the timely and the transparency sharing of information, so that what saves is early detection, early care. Rwanda has proven that although usually previous Marburg outbreak had a case fatality rate around 80%, when early treatment and early detection happened, they were able to reduce the case fatality rate. So just to reiterate again, we live in a world that's changing, climate change, all that thing, it will be there, but we can prepare so that outbreaks doesn't need to end up large outbreak like the West Africa Ebola outbreak. So early detection, early response saves life, and timely information sharing with WHO, with member states, will always save lives. Thank you.
Thank you very much, Dr. Abdi. And on that is a very good note to end this press conference, but I'd like to really emphasize you've asked a lot of questions about finance, and we've just launched an emergency appeal. We've a really good document which will explain to you how you get bang for your buck. We're just talking about all the things that we need to do to protect health, protect the health of every person on this planet. So please read that document. We've sent it out to you. And I'm going to ask Dr. Ryan if he's got any other points he'd like to make on that. Over to you, Dr. Ryan.
No, Margaret, I think we're almost at time, and I would like to thank to all of the donors and investors who've continued to provide support for the health emergency appeal over many years. We're trying to raise $1.5 billion to support health emergency interventions across a range of countries and geographies and settings and events for the next year. I hope, even in the context of contracting resources, that we can continue to do so. The needs are growing exponentially, as I said previously. The pressure of conflict and displacement, of climate change, of contagion and epidemics have really intertwined and mutually amplified across huge geographies in this world. And we are dealing with the consequences of human behavior. Conflict is human behavior. A great proportion of disease emergence, amplification, and dissemination is driven by human behavior. The previous speaker, or the previous journalist, asked about Marburg ecology and evolution. Many diseases are accelerating in terms of their emergence, their amplification, and dissemination. We've seen Mpox, we've seen Marburg, we've seen Ebola, we see cholera, an ancient disease that scourged the humans for centuries. Is being driven by climate change, driven by droughts and floods, but also driven by human poverty, by human exclusion, by marginalization, by hundreds of millions of people who live in fragility, who live in overcrowded slums without adequate access to water and sanitation. So when we look at the risks we face, sometimes we tend to blame nature, and we say that these pathogens of disease X are out there planning their assault on humans. They are not. We anthropomorphize pathogens at times and give them brains that they don't have. Pathogens are very simple things. They exploit opportunity, evolutionary opportunity. That opportunity is mainly provided by man. The way we exploit the environment, the way we manage the environment, the way we abuse the environment. And much of what we're doing is driving disease emergence. Much of what we're doing is allowing those diseases, once they emerge, to amplify quickly in human populations. That can be amplifying in an underprivileged slum. That can be amplifying in an underserved hospital where infection prevention and control is not adequate. And those diseases can then disseminate globally very quickly because of the connectivity we have on the world. So whatever threats we face today, it's not because nature is planning our demise. It's because we as humans are leaving huge gaps in the protection of our populations, both from those diseases and the vulnerabilities we leave in place in society that allow those diseases to not only exploit and spread, but to kill. And much of the death and destruction, and Maria referred earlier to the death and destruction from COVID, much of that death and destruction was mediated by the fact that so many of our people have underlying conditions that haven't been adequately treated, have poor access to healthcare, could not get access to oxygen, could not get access to intensive care when they needed it. So in as much as the pathogens are causing problems, it is our system and our society and the way in which we misdistribute health. In a sense, we distribute health in an equitable fashion. We cause financial hardship to hundreds of millions of people on this planet because they cannot access healthcare without economically destroying themselves and their families. So we do face major challenges, but we also have hope. We have fantastic hope. We have hundreds of thousands, millions of healthcare workers out there working in surveillance, working in public health, working in frontline primary healthcare, working in maternal and child health, working on trauma in places like Gaza. There's a front line, a thin line of health workers in the world who bravely step out every day. They go to work to save lives. Our job is to support them. Our job is to find the funds to support those, particularly those working in compromised and complex situations. And I do hope today that our member states and our donors and our investors can continue to invest. I'm speaking to you from Kabul in Afghanistan. It's been an amazing trip here. I've spent my time with our country representative, Dr. in Salvador, met many people at different health centers and met our partners. I'm absolutely amazed at the way in which Afghan health workers, men and women, are continuing to serve in the system here and the way in which our health partners continue to support them. So I leave you with a message of hope that for a very small investment, we can change the experience and the life course of millions of people on this planet. We need to make that investment, and we need to focus on protecting the health of populations and providing for their health needs. Thank you.
Thank you very much, Dr. Ryan, for giving us some hope, bringing hope in 2025. And on that note, I will hand it over to Dr. Tedros to close the press conference.
Thank you, Mike. That was excellent. So nothing to add. And I would like to thank the members of the press for joining us today, and Happy New Year. See you next time.